Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. Series 1 of Family Health by Mini First Aid podcast is sponsored by Savlon Scar Prevention Gel. Savlon Scar Prevention Gel helps soothe pain, promote faster healing, as well as reducing the risk of scarring when used on minor wounds, superficial burns and grazes. With 6 children in my house, scrapes and cuts are plentiful, so my first aid box saviour is Savlon Scar Prevention Gel. Hello, I'm Kate Ball, founder of Mini First Aid, and welcome to our podcast Family Health by Mini First Aid. It is absolutely brilliant to hear that you've been enjoying our new Family Health podcast series, where we continue to bring you top family health advice from leading experts. So without further ado, I am delighted to introduce our guest today, Kat Shehu from Meningitis Research Foundation. Kat manages the support service and the membership at the Meningitis Research Foundation. She also recently joined Mini First Aid at our annual conference, where she delivered training on meningitis to our huge team of first aid trainers. Welcome to the show, Kat, and thank you very much for joining us.
Thank you so much for inviting me. Absolutely.
Kat, tell us a little bit about yourself and what you do.
So I joined MRF, Meningitis Research Foundation, around 4 years ago. So it's my role. I help to make sure that everybody who needs support around meningitis, the after effects, sadly sometimes bereavement, and not just the person themselves, but also their family, friends, maybe colleagues that have questions or concerns or worries can come to us. And so I make sure that and the information that we give is accurate, specialised and trusted. And I'm really, really proud of the service that we're able to provide to people.
Thank you. And today we've invited you to chat to us about your experiences working for MRF. And we know that the very mention of meningitis can be incredibly scary for families, can't it? And so the aim of today is to make sure that everybody feels confident, recognising the signs and symptoms of meningitis, and they know how to treat suspected cases.
Absolutely. So we know from studies conducted that meningitis is the foremost kind of disease, childhood disease that parents are worried about, ahead of other ones, really. So we know, from kind of feedback from parents, that this is due to the speed that meningitis strikes, the devastating effects, and kind of the kind of rumour and panic that there is around the disease. So we want people to be able to kind of spot symptoms and feel more reassured and confident around meningitis. So I'm a parent myself, and I know that when my children were young, meningitis, as I said, is something that I was consistently worried about, and also something that I knew the least about. And so, and that was from kind of seeing scary kind of media coverage, from seeing children that had died very quickly and things like that. So it's really important for me that parents feel well informed and take that worry away, really.
Okay, so in the simplest of terms, can you explain to families listening what meningitis actually is?
Absolutely. So simply, meningitis is the swelling of the meninges. So that's the lining around the brain and the spinal cord. And it's caused mainly by germs entering and invading the body. So there are many types of different germs that can invade the body, but the 3 that we know can cause meningitis are bacterial. So this is the one that most people are most worried about. And it's usually the most serious form of the disease. So somebody who has bacterial meningitis requires urgent medical care. And when I talk about those scary media stories, it will be generally bacterial meningitis that we'll be talking about. Also viral meningitis, which is rarely life-threatening, and it very, very rarely causes septicemia. But we do know that people who have suffered from viral meningitis can go on to kind of live with after effects. But I'll talk about that kind of later. And also fungal meningitis, which is very, very rare in the UK and Ireland, but it is very, very serious. It usually, if it is in the UK and Ireland, it usually only affects people with weakened immune systems, but it is very, very rare.
Okay, so is there an age group then that are more likely to be affected by meningitis than Kat?
So we know that babies and very young children are high risk. This is due to their immature immune system, and you'll see that as I talk about vaccines, that's taken into account by the childhood vaccination schedule in the UK and Ireland. Also, young adults around university age and those who have weakened immune systems, as I've mentioned.
Okay, so is there a time of year that you're more likely to get meningitis?
So it's also really important to remember that meningitis can strike at any time in the year, but we know that winter is a special concern. So as the temperature drops, people tend to spend more time indoors and close proximity. So this allows things such as sneezing, coughing, breathing each other's breath. That allows kind of an easier way for kind of germs to circulate. So we also know that common winter illnesses such as the flu can make us more susceptible to illness because it lowers the immune system, which then can make us susceptible to any kind of germs and infections and things. I would like to say though, because I as I spoke about kind of rumour and panic, I would like to say that, most of us at some point in our lives will become exposed to the bacteria that can cause meningitis.
Oh, wow.
And yeah, so it's carried in the back of the nose and throat. But most of us will never become poorly from it. And that's why our research is so kind of important, because that's something that we don't fully understand. So I can get somebody through on the support service who, has a weakened immune system, maybe have been suffered with chemo, and recovered, and then become poorly with, bacterial meningitis, and you think, well, maybe that's the reason. But then the next day, it might be somebody who's never smoked or drank alcohol, runs marathons, very, very fit, that kind of thing, who is equally affected. So that's something that we don't yet understand, and that's why research is so vital, and what we do is so vital. What I will say is that I don't want to kind of invoke panic. So, it is something that only a small people do become poorly with, but it is incredibly important that people understand the signs and symptoms and realise that somebody who is poorly with bacterial meningitis just need urgent medical help. Definitely the winter is something that we see an increase in. And we know that somebody who's poorly with something like the flu or something can make it easier for bacteria to cause meningitis through and occupy the nose and throat.
Can you get it more than once?
It is rare, but it is possible. So it is something that I have seen, yeah. But I will stress that it is rare to kind of contract bacterial meningitis more than once. With viral meningitis, there are a small number of people who come through to us, and reoccurring viral meningitis is also called something. It's called Mollaret's meningitis, and that's down to the physician that coined the phrase many years ago. But Mollaret's meningitis is something that does need kind of looking into in hospital. Basically, for the cause of it, there will be a cause of recurrent viral meningitis. In terms of bacteria, it's very rare, but it is possible.
So I find this fascinating and still perhaps a little bit scary. And I know you're going to go on to give us some more reassurance, but the fact that it can just be a common cold bug, perhaps in the winter, that then means that you receive the bacteria, and that could be, we need to know more, don't we? But that could go on to develop meningitis. And that's, I think sometimes people just expect it to be some big, nasty, ugly bug that, and it's not, is it?
No.
I think the other thing that sometimes I get a little bit confused about is meningitis and its link to sepsis. And could you just explain a little bit about that so that we understand that?
Exactly. I think the reason that people get so it is quite confusing, and I was exactly the same, is because meningitis and septicemia can occur kind of together or separately. And people hear these really large terms such as pneumococcal septicemia, meningococcal septicemia, but it's basically just detailing the germ which has led to the disease. So simply answer, as simply as I can, as I explained about the germs kind of entering the bloodstream and invading the meninges, the same germ can instead enter the bloodstream and invade and infect the blood, and cause blood poisoning, which triggers sepsis. So it's basically the same form of germ that which infects the blood instead of the kind of the meninges. So meningitis, meninges, and septicemia, sepsis relates to blood kind of borne infections. So both are really serious diseases. There is a lot more information on our website if people are confused around the two. There's actually a blog post which is really, really kind of informative and helps to break down those different kind of long, terms and words that can kind of put people off wanting to know more. I think the most important thing to take away from it is that all of the words that I've used today are related to a serious life-threatening response to infection, either within the blood or the meninges.
Right.
And so, what I would say to people is that if they do want to know more, to head over, and there's a blog post which, the difference, what is septicemia, what is meningitis. So, but that's the most basic way that I can explain it.
Kat, thank you. Let's talk about signs and symptoms then of meningitis. What are they? What should we be looking out for?
Absolutely. So, as I said, and I've said it, and I will keep saying it, I'm a parent myself, and I understand I've got 5 children. So my children had ear infections, nose infection, every single infection that you could possibly get over the years. And what I will say is that people become confused because meningitis in the early stages can look like so many, really routine kind of childhood diseases, childhood infections. So the key first symptoms to look for are usually fever and vomiting, headaches and feeling unwell. Limb pain, the pale skin and cold hands and feet often appear earlier than the rash or the neck stiffness and the dislike of bright light. So they're the more kind of characteristic kind of meningitis symptoms. Adults and older children who are able to vocalise will often say that they feel more poorly than they've ever felt in their life. They often have a kind of impending sense of doom. They know that they're very, very poorly, but that's really hard when you're a parent of a young child that can't kind of vocalise. What I will say is that they will become very poorly dramatically, very quickly, and so to regularly monitor your child. To look out for things such as in babies and young children, a temperature of over 38 degrees with cold hands and mottled skin, very fast breathing or grunting sounds, a bulging soft spot, very lethargic and hard to wake, no kind of urine-soaked nappers within 12 hours, reluctant to feed, a high-pitched cry, something different to how your child normally sounds. So will all know your child or your family member better than anybody else. And also a rash that doesn't fade when it's pressed with a clear glass. Now that's called a tumbler test. Also, another thing that you can do with maybe older children who understand more is something called the chin to chest test. If they're unable to put their chin down to their chest, it's too sore and too stiff and too painful, that's a really good indication that there's something very wrong back there, at the back of the neck, and something to look out for. But in the first kind of key symptoms usually do look a lot like other kind of childhood infections. So it's around monitoring, knowing your child, trusting your instincts, and getting medical help, and kind of and looking for those kind of more extreme symptoms, such as, like I said, stiff neck, dislike of bright lights, and those kind of things. In very, very young babies, so we're talking under 3 months, usually there's a persistent refusal to feed, or they're bringing foods back up, lethargic and excessively sleepy. So young children do sleep, but as I said, you know your child more than anybody else. May be irritable at different times than they normally would, stiff or floppy body, grunting, I say a bulging soft spot. But it's really important to remember that not everybody gets all of the meningitis and septicemia symptoms, and they can occur in any order. There's a lot there to consider.
There is, that's massive. And the list, I think the fact that you said that it didn't appear, there's no specific order, you can't go down a checklist. Now, you mentioned the rash, and obviously some of our listeners may have black and brown skin, and it would be interesting to understand how that rash might look different from perhaps somebody with white skin.
Absolutely. So what we know is that the rash on darker skin can it doesn't look as you can't see it as easily.
Right. Okay.
So what we say to people is to check the whites of the eyes, the soles of the feet, and the palms of the hands, along with also continuing to check the rest of the body, the torso and back and things like that. There's also one of the things I was saying about kind of union panicky meningitis is that that spots will only appear in certain parts of the body, maybe on the back or on the chest. That's completely no. It can start and happen anywhere, and will usually spread very, very quickly. But like I said, the key point would be to look for the soles of the feet, palms of the hands, and the whites of the eyes, and things like that. But also on darker or lighter skin, the tumbler test is really important. So you get a clear tumbler, a glass, push it against, and if it doesn't go, so a rash that we're worried about will not go, and that's called a non-blanching rash. That's not something that you have to remember. You can just say a rash that doesn't go. But it gives you a clear view that actually that this is a rash that's something that you should be a little bit more concerned about and get medical help for.
So if you suspect meningitis, and obviously again you're second guessing a little bit because there are so many symptoms there, but if I'm being mummy and I'm going with my gut instinct, which says that this isn't right, or my baby or child is behaving in a way that's not normal for them, or perhaps they're more poorly than I would normally expect them to be, what have I got to do? Who do I have to tell?
So what I will say about symptoms is that, like we've said, symptoms can be confusing. So we've been working with medical professionals on our website to put in red and amber symptoms. So we do get lots and lots of parents of poorly children or poorly people, even themselves or family members that go on there, and there's a list of kind of red and amber symptoms. So if you're in red, you dial 999 straight away. Amber, it might be NHS 111. So what I will say is that if it's apparent that your child is very, very poorly and becoming very, very poorly, more poorly in front of your eyes as you watch them, you need to dial 999. If it's something that's less kind of imminent, you're unsure, you don't know, then definitely call NHS 111 for a medical assessment. But it's really important that you make some of the symptoms will stand out more than others. Like I said, when my children were young, most of them had temperatures, had cold hands and feet. That just goes along with being poorly. But saying things such as a stiff neck, a really horrendous headache, a high pitched cry. They don't sound like themselves. Their body is floppy. You don't have to remember non-blanching rash, but you can remember a rash that doesn't disappear when it's pressed with a glass. These are all things to make sure that you say. Go armed with every single symptom that you're recognising. But in a emergency situation, 999. In a non-emergency, I don't kind of know situation. It's NHS 111 or an urgent same-day appointment with the GP. If you're waiting for that appointment or you're waiting for NHS 111 to call you back and your child or family member or you become very, very quick, more poorly very quickly, then just dial 999. We would much rather you call somebody 10 times and it not be meningitis and not make that call. So what we know is that parents have to worry about wasting people's time. They have to worry about going back. And they often worry that, that they're we know that the NHS is busy, we know that the NHS is stretched, but it's really vital that that person gets assessed and assessed again if their symptoms change. So we understand that it's scary, but you're really not wasting anybody's time. And we don't want anybody to sit at home kind of worrying when a medical assessment is what they need.
So if a family member, your child, somebody in your family goes to hospital with suspected meningitis, whether that at this stage is that you suspect it or whether that's a healthcare professional that suspects it, how is it treated? What happens next?
Absolutely. So if somebody is taken to hospital and doctors believe that bacterial meningitis is a possible diagnosis, so the only way to test at present is a lumbar puncture.
Okay.
And that involves collecting a small sample of cerebrospinal fluid, CSF, in the base of the spine.
Right.
So one of my children has had a lumbar puncture. Actually, it was a really, really scary experience. So I understand exactly why that does sound scary, but it is vital.
And it's from the base of the spine.
It is. It's the same as it's the same kind of procedure as an epidural. It's when you're in labour or for pain relief and things like that. So that's the only way to determine at present. We would love for a one-stop test to be able to say yes, this is, no, this isn't. But at the minute, it's a lumbar puncture, and that can be really not very nice for parents and family members. But we do know that it is vital. And so it's the only way to say kind of the A or no. Mm-hmm. Before the tests come back, if doctors suspect that it's bacterial meningitis, they will start the patient on antibiotics into the vein and admit into hospital. And so that's to kind of get a take on any infection that may be there. So lumbar puncture results can take 2 days, sometimes, yeah. So
oh wow, I didn't. I've got a shocked face here. If anybody's not watching and just listening, oh my gosh, I didn't realise that. So up to 2 days.
Yeah, it's not instant. It's not an instant kind of, because they have to see what kind of bug is growing, what kind of bacteria is growing. So what they will do is, if they suspect it's bacterial, then they'll be put onto IV antibiotics and admitted. They will need very, very close care. I mean, it's a race against time, really. The quicker that somebody gets admitted and gets these antibiotics, then the kind of the hopefully the better the recovery and also the better chance of survival. Also just to say that if an ambulance is called out or a GP at your GP surgery suspects meningitis, they've also got the means and equipment to administer a first shot of antibiotics before they get into hospital as well.
I didn't know that. Right. Okay.
Yeah. So, and it's impossible for me to say how long they'd be in hospital and how long the course of antibiotics and what antibiotics they would be. So, that's because each person is different, each person's recovery is different, but they will need quite a long stay in hospital. It's often kind of 1 to 2 to 3 weeks and a long recovery. We do know that this is a really traumatic time for everyone, the patient themselves, but also wider family and friends, and that's why we're here to help, kind of why we're here. We support around worries, answer kind of medical questions, and support with open dialogue around the kind of medical teams in hospitals and things like that. And people often do have a lot of questions that, that they just forgot to ask, or, want answered, but their consultant isn't around at that time. So, it's not a quick process, but everything is in place to give somebody the best chance of recovering. And with regards to viral meningitis, it often Some people do recover from viral meningitis at home without ever going to hospital. However, what I will say is that most people I've spoken to who've had viral meningitis, they explain that the headache is the worst headache they've ever had,
Okay.
excruciatingly bad. And that usually stops them from living their normal life, and that can include eating and drinking. And so often hospital admission for viral meningitis is around kind of pain relief, and fluids to guard against dehydration. And people may stay in hospital around 5 to 7 days before being sent home to recover.
Okay. Let's talk about complications then. Can there be complications after a person has had meningitis then?
Yeah, absolutely. So we do know that some people will recover from, if we talk about bacterial meningitis. So we know that the long-term recovery means that their after effects can be sadly sometimes life changing, and can last for the rest of their lives. Sometimes they are short term and kind of neurological changes. Headaches are very common, tiredness, excessive tiredness. And it's not uncommon for somebody to be recovering at home before going back to a phased return to school or work for 3 to 6 months.
Wow, that's a long
Yeah,
time, isn't it?
it really is. And if you think about people that I speak to, they're often parents, they've often got jobs, they may be the only breadwinner, they may be, there's so many things that we have to, life is busy, and we have a lot of, commitments and things. So that's something that, people are often unaware of and not prepared for. Changes in mental health, anxiety, epilepsy, um, and kind of personality. So subtle changes in mood, or things that annoy them that maybe didn't before. Other people can say that they can see that you've changed, but you can't particularly see it yourself.
Okay.
I think the hardest thing of all of this is that they're hidden, and people think to themselves, "Oh, well, you're home now. You can't see it. You can't see these headaches. You can't see these mental health issues." So we do know that with kind of children, there can be behavioural changes. Lots of parents say to me that their child just doesn't seem the same child as they did before they were poorly. It can be quite hard with very young babies that don't go on, because we never know whether they might have had these behavioural changes, but whether they were just born like that, or
Mm-hmm.
that's something that meningitis has kind of, has done. Um, but usually, if you're looking at kind of neurological differences, it's generally kind of eyesight problems, hearing problems, headaches, tiredness, mental health, personality, and behaviour.
Okay. I know we have a family friend
Mm.
whose child has hearing loss as a result
Yeah.
of bacterial meningitis. Are there any other physical complications within that people can experience after having had meningitis?
Yeah, absolutely. So what I was surprised to learn actually is that meningitis is the largest reason and cause of childhood hearing loss in the UK.
I didn't know
Yeah,
that. Oh my
but
gosh,
no,
really?
it's something I only found out when I joined MOF, and yeah, so it's massive, and hearing issues. So and eyesight problems, and kind of that can be a complete loss of eyesight, or partial. Same with hearing as well. So we do know also that with septicemia, people, because of the kind of blood poison, because the poison blood is going around the body, there are people who, lose limbs, sometimes,
Right.
quadruple amputees, and or it may be the end of a limb, or it may be a full limb. And we know that kind of bone scarring, and that it can affect so much. I mean, it's a massive, it's a massive loss to anybody. So amputations, hearing loss, eyesight issues, um, they're the main kind of after effects of meningitis, and kind of septicemia specifically.
So people, families listening to this must be going, hang on a sec, this all just sounds catastrophic. And surely to avoid this risk of this bug that might just come as a common cold bug, there's got to be a vaccine, right? Can you just talk to us about what's happening in the world of meningitis vaccination?
Absolutely. So, first off, it's important for me to say that we can't vaccinate against all forms of meningitis. We just can't. And also, what I will say is that the vaccination schedule in the UK and Ireland is really, really vital in keeping people safe. So vaccines alongside clean running water is the one thing that has given us the best kind of chance of survival from the moment we're born. And the vaccination schedule that is in place now will be very, very different to the one from when I was born all those years ago. And that's because they're adapted over time in response to kind of research findings and ongoing disease surveillance. And so we do get quite a lot of questions around vaccines. So research kind of shown that something called a conjugate vaccine protects the vaccinated kind of by helping to show the immune system how to fight these infections. So these are all actually terms that people used to look at me before and go, but since COVID, we've got such a bigger understanding of around, vaccines and things. And we also know that conjugate vaccines help to stop other people passing on the disease by stopping it kind of forming in the nose and throat. And so this is helpful in something called herd protection or herd immunity, which has been heard on the news quite a lot of recently. That has gone on to kind of inform how vaccines how strategies have been kind of promoted globally around vaccinations. So that's a really important thing to realise, that not only does a conjugate vaccine kind of vaccinate against that strain, it also stops the transmission as well. So if I can say in the UK, so they were the Hib and Mensu conjugate vaccines were originally routinely given to infants because we know that they were kind of the highest risk of contracting this disease. However, the research has shown that conjugate vaccines just didn't provide direct protection, but it could also help protect the wider community. And so this means that by vaccinating the age groups that are most likely to carry bacteria, the wider protection kind of carries across to the whole community. And this is what's behind the ACWY. So the MenACWY vaccine, you may know that it's given at year 9 to 14-year-olds. Yeah, okay. So that covers against the A, C, W, and Y vaccine strains. So we know that this age group are kind of key to transmission, and you're 4 times more likely between 16 to 25 to carry the bug at the back of your nose and throat than at any other time in your life.
Gosh, that's quite a significant number, isn't it?
It really is, yeah. So, and I've got 16 to 25-year-old age children. So, the worry of them going off to uni and things like that. But it's really kind of key that these conjugate vaccines, given to this age group, also then help to protect other people of that age. So even if there kind of is, that the one person out of 100 that isn't vaccinated, or is vaccinated later than everybody else, then it kind of keeps disease levels very low by kind of herd immunity doing its work. And some of the leading bacterial causes of meningitis have also been wiped out in parts of the world. So in the UK, the Hib vaccine was introduced in 1992, which has resulted in more than a 90% reduction in meningitis caused by Haemophilus influenza flu type B. And today, even now, of course, the cases remain rare. So it's had a massive, massive effect. Mm-hmm. But one thing I will say to parents is if they want to know more about the UK and Ireland immunisation schedule, to go on to Google it. It will come up with every single vaccine, and also all the way through your life as well. So including the ACWY and the pneumococcal vaccine in age 65 and over. So. Yeah.
Kat, I know that there's been lots of discussion on the news recently about the fact that actually we have an amazing vaccination programme in the UK, but there might be people listening concerned that through the period of COVID times that there might have been a missed vaccine. So their child missed the opportunity, or perhaps there was no appointments at that point. If people are unsure or not sure about whether they've received the vaccine or whether their child or family member should have had the vaccine, where do they go?
So your first port of call, if you're talking about somebody who's at school, the school nurse team will know whether somebody has had the vaccine. So we do get people come to us and say, I don't know if I've had the ACWY. I don't know if I was away from school that day, or I was poorly, or I was on holiday. And so there's two places you can go. One is the school nursing team, who will have a record, and second is the GP. So what should happen is that all kind of external vaccinations that are given, such as at schools or community, other community centres, will be passed over to the GP. And so your GP will have a comprehensive record of your vaccination over the years, should have. What I will say is that if you cannot remember having the vaccine, or you can't remember somebody else having the vaccine, and there's no evidence of them having the vaccine, such as it isn't on the school nurse records, the GP hasn't got a record of it, then work on the basis that they haven't had that vaccine. And if it's on the immunisation schedule, then it will, then catch up can be put in place. So the first place to go is to a GP or to the school nurse if it's about a child that's sort of school age and administered at school. But yeah, that's what I would do. There's also a meningitis vaccine tracker, ACWY vaccine tracker on our website, which can see whether you're eligible for the ACWY vaccine. But if you do have any questions, just reach out to us. We can always kind of give you, often some people come to us with regards to travel, so there are different countries that, where people need different vaccines. So we can give them advice around, where to get travel vaccines and cost and things like that. But with regards to the immunisation schedule, the GP should be your first port of call.
Kat, thank you. That's really interesting and really helpful, particularly for those with vaccine questions. So I've got a final question for you then. Yeah. Having listened to us chatting today, what do you yourself as a parent, but also as a representative of the Meningitis Research Foundation, want families to take away from what we've talked about?
Okay. So I hope that today has made people feel kind of more informed, and what I hope that people don't feel panicked. I think that's always my main concern, is that I don't want to panic people. I just want people to be aware of the signs and symptoms, and the risk, but also what to do if somebody is poorly. So what I would like to say is that, meningitis is out there. It just is, and that's why we're here doing what we do. But it shouldn't take over people's lives. I want people to continue to parent their children in the normal way and to enjoy their children and not to worry excessively. The best thing that you can do is to vaccinate your child, be aware, or yourself, be aware of the signs and symptoms, and to trust your instincts if something, if they are poorly. And to remember that most people do not become poorly from the germ. But some people do, and that we are here to support people, if they do need. It is safe for your friends to play with, for your children to play with friends, to attend their childhood, education centres. Maybe that's a creche or a school or a college or a uni, and not to worry about letting them just be children. We're also a part of the first global kind of roadmap to defeat meningitis, working alongside World Health Organization. We're incredibly proud of that. And actually, what we know is that, the global burden of meningitis, has really become apparent. And so all of the information, any questions that you've got around what I've said today, you can find us at www.meningitis.org. On there, there's all, like I said, everything that I've spoken about today, but also information about how to contact us and contact me. And I'm always here to answer any kind of questions or worries or concerns that people have. But my main thing to take away is just not to worry, but just trust your instincts and be aware.
Kat, thank you so much. And I know that it's reassuring that you can sort of empower parents and carers to go, I do trust my own, trust my own instinct, because we do know them best of all, don't we?
Yeah, we do.
Kat, thank you so much. Thank you so much for all your insights. I think we could have gone on talking for hours, and I'm sure there will be some people with questions. And Kat has very kindly said that you can reach out to MRF via meningitis.org if you need to. So thank you to all of our families for listening today. You can watch a video of this whole conversation today over on the Family Health by Mini First Aid YouTube channel, and also make sure that you follow Mini First Aid so that you can keep up to date with family health and all of our Mini First Aid conversations. If you want to listen back, this podcast is available on all of your regular podcast channels. Thank you for joining us today. And Kat, thank you so much for spending time with us today.
Thank you.
Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. I take Savlon Scar Prevention Gel everywhere with me so that I'm always prepared for the many little and sometimes bigger accidents that my kids encounter. Thank you again to Savlon Prevention Gel for sponsoring Series 1 of the Family Health by Mini First Aid podcast.